How dangerous is an enlarged prostate? Does it mean you have prostate cancer? Does it explain why you're waking up at night to urinate or why your stream is weak? Not always. The truth is, prostate size isn't the full story. Your bladder, your nerves, and how they work together matter just as much. Welcome to the Dr. Geo Prostate Podcast. In this upgraded replay, Dr. Geo Espinosa breaks down the truth about enlarged prostates, when it's a real problem, when it's not, and how to know the difference. Let's get into it.
Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age.
How dangerous is it really an enlarged prostate? Am I really at a higher risk for prostate cancer? What if it's not causing my urinary problems? An enlarged prostate, how serious is it? That's our focus for today's episode. A lot of confusion with an enlarged prostate. So let's unpack this a little bit. A normal sized prostate depends on age, but let's just say is about 30 grams, which is roughly about the size of a walnut. The size of an adult prostate, a normal size, the size of a walnut. I've literally have seen a prostate that's 300 grams. So it's like 10 times as much, right? 10 times bigger. And that's like the size of an orange, of a medium-sized orange. And that's a big prostate. The problem here is that every time that a man is diagnosed with an enlarged prostate, the thought process is, well, then all your urinary symptoms are a result of that enlarged prostate. Because your prostate is so big, that's a huge problem, no pun intended, right? And you need to treat it. And that's why you're having urinary frequency, urinary urgency, your stream is slow, you're waking up 5 times a night. They slow a stream because there's some inhibition of the flow of the stream, right? So there's an obstruction somewhere in the urinary pathway. A slow stream, that is the main indication that there is an obstruction. And it might be, not always the case, it might be the fact that the prostate is enlarged. Let's unpack that a little bit more, right? Because it turns out that the bladder sits right on top of the prostate, and there's a tube that goes right through the prostate that brings out the urine and the semen, right? The tube is called the urethra. The obstruction can be from the area that meets where the bladder meets the prostate. So it could be from that area. It could be just squeezing of the prostate, despite the fact that the prostate is small. So you could have a 20-gram prostate, so that's a small prostate, but still squeeze the urethra. You can have a big prostate and not squeeze the urethra. The issue is the obstruction and the squeezing, and that's it. There could be a urethral stricture, which is some sort of tissue that's developed in the urethra, right? Some dead tissue that keeps developing, and it closes in that pathway, causing a problem to urinate, a weaker stream. But Dr. Geo, oh man, I woke up this morning and I had to be there for a long time. I was there for 3 minutes. But then after that first pee, my stream is very good. It's always that morning pee. Is that a problem? It may or may not be. For many people that I see, we treat it naturally. It's not a huge problem necessarily. Sometimes that morning pee, for many reasons, or that pee in the middle of the night is slow. It seems like the urinary system is still a little sluggish, right? It's still sort of half asleep. It takes a little longer. I don't always think that is a result of the prostate, that first morning pee. Now, if you come and tell me, Dr. Geo, I'll tell you, my stream is slow all the time, morning, afternoon, night, well, then that's a different conversation. Then we're probably talking about some sort of obstruction that we need to pay attention to. So is having an enlarged prostate a problem? It depends. Big prostates where they do have urinary problems is not always the prostate. Remember, the bladder also plays a role, and sometimes there's overactive bladder involved. Sometimes there's a combination of overactive bladder and prostate. Sometimes there's urinary retention because, yes, something is impinging or closing in on the urethra, and there's backflow of urine in the bladder, and that's causing havoc in the bladder. That's causing the bladder to kind of misbehave and not work properly, right? Because how it works in a normal situation is that there's beautiful synergy between the bladder and the prostate. Bladder squeezes, prostate opens, bladder squeezes, prostate open, bladder, and that's beautiful synergy. The problems occur when there is the synergies, there is dyssynergy, where the bladder squeezes and the prostate doesn't open, or they're not in sync. It's not happening smoothly, where the squeezing and the opening of the prostate, it's occurring. So, and that oftentimes is a neuropathic problem. That's a problem with the nervous system that innervates the bladder and the prostate. The urinary problems that occur in men, it's not always related to the prostate, even if there's an enlarged prostate. And sometimes, honestly, some of the medications and prescriptions that are out there to reduce the size of the prostate, I think they're uncalled for, and they cause other issues and hormonal issues. It turns out that one of the few podcasts that I listen to when I have time is Tim Ferriss's podcast. And he interviewed an amazing interview of this man who's almost 90 years old, really inspirational. Anyway, Tim asked him, you have this great hair. How can, at 90 years old, your hair is so great? Well, the person said, it's probably a result of very nice side effect from a drug that I use called Finasteride. So Finasteride is a drug that makes the prostate smaller. It blocks the formation of a particular hormone from testosterone called DHT. So it blocks that from happening. There is no DHT. And as a result of that, the prostate gets a little smaller by about 20%. The hair component of that story is that DHT seems to induce hair loss and cause male pattern baldness. So this gentleman suggested, I think that's why I have this gray hair. But the problem with these drugs called 5-alpha reductase inhibitors are that just because one has a big prostate, it doesn't mean that's causing the urinary symptoms. So they get on these drugs and the urinary symptoms do not resolve because that's not the cause. So that's the problem with thinking that enlarged bladder is causing the urinary problems. And then they get prescribed to Dutasteride or Finasteride or any of these drugs that may cause hormonal imbalances in the body and not always induce the urinary symptoms that you're trying to avoid. All right, Dr. Geo, but man, I know that if my prostate gets big, I think that I'm going to get prostate cancer. No, no, you're not. One thing is not linked to the other at all. So an enlarged prostate is not linked to prostate cancer. Okay, so there has to be, if I have a prostate that's the size of an orange, that has to cause some problem. Not really, unless that enlarged prostate is causing urinary problems, which it can. One caveat is that if the prostate, I'm talking about a small orange, let's say it becomes a big orange, 400 grams. Well, there are nerves around the prostate that innervate the penis, right? So if these nerves impinge or obstruct the flow of that nerve to the penis, then it can cause erectile dysfunction. So for reasons that are more related to the nervous system that causes an enlarged prostate, sometimes in those scenarios, that can cause urinary problems, which there are treatments like not done by a urologist. It's called PAE, not done by a urologist. It's done by a radiation interventionist. And something for you to look up. So what are the tools that is not dependent on the PSA test to prevent from getting a biopsy, or at least an unnecessary biopsy? Such a test is the ExoDx. It's a urine test, non-PSA dependent, that gives you a number, and your practitioner and the two of you can make a decision based on that number if you need a prostate biopsy or not. So next time you go to your urologist and they say, well, listen, let me prescribe these drugs, I want you to have better questions. And this is not to be confrontational with your urologist. You get nowhere with that. Good question. Well, I have an enlarged prostate, I have urinary problems. You're prescribing finasteride, dutasteride. Other drugs, by the way, are probably fine. Tamsulosin, as an example, may be helpful. But the bottom line is, how do you know, Dr. Smith, that because my prostate is enlarged, that's causing my urinary problems, and that's the issue that we should address? What they'll do in an office is a PVR, a post-void residual. So they'll do an ultrasound after you go pee to see how much urine you have in your bladder after you're already evacuated. You can ask them, how do we know that it's due to an enlarged prostate? And what are the better drugs that are not 5-alpha reductase inhibitors? That's a technical term, but things like finasteride and dutasteride. And ask them about it. Those are the questions you need to ask. And of course, my PSA is high. Can that be from the fact that I have an enlarged prostate? In other words, I just don't want to go for a prostate biopsy, which is invasive. If I don't have to, how can we determine if my high PSA, my elevated PSA, is a result of having an enlarged prostate? I trust this episode is helpful, and I bring the goods every single time. Keep living your best life with age. Keep tuning in. I want to ask you to sign up to all the different platforms, or the platform where you listen to this podcast, and give me a like if you think I've earned it, and a comment. It really does help get the message across. This is Dr. Geo signing off. I'll talk to you next time.
If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.